I am Dr. Antonella Fine, and I am an infectious disease physician, and I am the Director of Hospital Infection Control and Antimicrobial Stewardship at Sterling Memorial Hospital.
Dr. Fine, can you tell us a little bit about what COVID-19 is?
Sure. So COVID-19 stands for coronavirus disease. Coronavirus disease is caused by a novel coronavirus that was discovered first in Wuhan, China, and is thought to have originated from an open-air animal and seafood market, possibly from a pangolin or a bat animal transmitting this new virus to humans, and from there has been human-to-human spread across multiple nations, now resulting in a global pandemic. So COVID-19 is a respiratory illness predominantly. The most common symptoms that have been described are fever, shortness of breath, dry cough, muscle aches, and fatigue. However, some patients can also have, in a lesser degree, sore throat, productive cough, or some GI symptoms like nausea or vomiting or diarrhea.
Okay. Now, you just talked a little bit about the symptoms. How sick can someone get from this illness?
So coronaviruses have been around for a long time, but what's interesting about this coronavirus is it's a new virus. That's why it's called novel, and we are still learning a lot about it. But from what we know from data coming from China and from Europe, Iran, South Korea, Japan, is that this disease in about 80% of people causes a very mild illness that is something like a flu-like illness, very almost indistinguishable from influenza. But in around 20% of people can cause severe or even life-threatening disease. So what worries us a lot about that is that the people who tend to get sicker from COVID-19 are those who are older age. So the estimated mortality rate for people who are less than 60 is really quite low, only about 0.9% with COVID-19. However, those who are 60 to 69 have a case fatality rate of 3.6%, those 70 to 79, 8%, and those over 80, 14.8%. So the reason that really concerns healthcare workers and hospitals is because having that amount of people who are over a certain age become ill at one time could really have the potential to overwhelm healthcare systems. Being able to take care of that many critically ill people and have the support, the trained staff, healthcare staff, and also people who know how to manage ventilators and have enough ventilator support for that many people getting critically ill. The people who tend to get more sick from COVID-19, regardless of age, happen to be those with chronic medical conditions, namely people with cardiovascular disease, diabetes, hypertension, chronic lung disease, chronic kidney disease, cancer, and other immunocompromised states.
So what, at this point, if somebody believes that they may have come in contact with someone who has been confirmed case or presumptive case of COVID-19, they're sick, what should they be doing at this point?
So right now, across the world, really, but also in our nation, since our president declared a national state of emergency, people in this country are being advised to practice social distancing. So that is important regardless of symptoms. So even people who don't have symptoms right now really should be isolating themselves from others. But that's especially true for people who are ill. So the concern is that if someone is sick with COVID-19, they can spread their infection to other close contacts. And the way this virus is spread is essentially through what are called respiratory droplets. If someone coughs or sneezes, those droplets can be kind of projectiles from their mouth, their nose, and can travel usually about a distance of 6 feet before their weight drops them to the ground. So that's why we're recommending a distance of at least 6 feet from anyone who could be ill. So people who are ill, we also want to teach them to cover their cough. If they have a mask, they can use it, although they really don't need a mask. We want to be conserving masks for healthcare workers who need them as they are in very short supply right now. But and someone who's ill can equally cover their cough with a tissue, or if they don't have a tissue, cough into their elbow. The tissue, if used, should be thrown away immediately. But we want to contain as many of those respiratory droplets as possible so we're not kind of spreading them into our environment, coughing onto our hands, and then touching surfaces which are then touched by other people. So the other way that someone can get this is not just through either being coughed directly on and inhaling those respiratory droplets, but also if they get on their clothing or their hands and then they touch their eyes, their nose, and their mouth, because virus particles can also enter the body through mucous membranes, and those are our eyes, nose, and mouth. There's no evidence so far that the virus can be transmitted through food or through other packaging, or that someone can get it just by kind of casual, distanced contact more than 6 feet away walking by someone. But really what we're trying to emphasize is that absolutely if someone has an influenza-like illness right now, fever, cough, body aches, that they should be isolating themselves at home from other people, even including their close contacts in the house. So if there is possibility to sleep in a separate bedroom, that would be a good idea. If they need to be around other family members, they should try to cover their mouth whenever they're coughing, as we described. If they have a mask, they should wear it when they're within 6 feet of other family members. And other things they can do is that they can clean their house, all high-touch places like light switches, door handles, the garbage can, things that everybody will touch in the household with bleach wipes, keeping the area as clean as possible. But the other point I want to make is that social distancing is important even for people who do not have symptoms. The reason that is important is because it takes an average of about 2 to 14 days for someone to develop illness after they've been exposed to COVID-19. Most people tend to become ill somewhere between 4 and 7 days, but it can take up to 14 days, which is why people who might have been exposed should isolate themselves from others, because they either might be infectious to other people before they even develop symptoms, or we're starting to learn that spread can even happen in people who don't have symptoms at all. That asymptomatic people, people who become infected but don't have symptoms, still have the ability to spread virus to others. So, long story here, but the education right now about social distancing is the reason why we're closing bars, we're closing restaurants, we're closing schools, and we're advising everybody to keep a distance and only be closer within their own family units in their home as much as possible, is because if someone gets sick in your household and other people in your household get ill, the illness should hopefully stop there. If transmission just happens within a family unit or close contacts within a household, then doesn't leave the house because we're all practicing social distancing, that's how we can stop new cases from coming and coming and coming. However, if people continue to practice life the way they normally do and look at this like a snow day or play dates, or everybody's off from work, we can all still gather at the park and play, or we can all have families still come over to each other's houses, then we're really effectively creating the same social environments we otherwise would have had schools, restaurants, and bars and workplaces all stayed open, and it's really defeating the purpose of social distancing. We're trying to make sure that whatever virus is out there already stays contained within the people who are infected without spreading it to others.
Thank you. Now, in terms of testing for COVID-19, how does one go about getting tested if they think they have it? Is our tests available for anybody who thinks that they may have the illness?
So the way that one is tested for COVID-19 is it is done via a nasopharyngeal swab. So a swab is placed kind of deep back into the nose, and that can be tested by PCR, it's called. It takes about 3 to 4 days for a test result to come back. The unfortunate reality right now in our country is that testing is very limited. There are not enough test kits, there are not enough even transport media enough for us to be able to have the ability to put the swab into the container it needs to go into in order to send it to a lab to be tested. And commercial labs and state public health labs are already overwhelmed by the number of tests that they've received thus far. Because of this, we are really unable to test all the people that we want to test and know that we should be testing. And we have been prioritizing testing people who are severely or critically ill in the hospital and testing healthcare employees whom we are really dependent on caring for these people. There at this time is no testing of outpatients in the sturdy system. We are really hoping that that will change. We're hoping that we will be able to get some more supply of test kits through our state public health department, but we have not gotten that yet. So we're doing what we can with the supplies that we have and prioritizing the sickest people.
And now, we talked a little bit about social distancing. What are some of the other preventative measures?
So in addition to the things that one should do in their home to try to keep their environment as clean as possible and to try to reduce transmission of their own infected respiratory droplets to other, by far most important thing is hand washing. So people should wash their hands for at least 20 seconds, and the main thing they need to be able to they need to focus on is being sure that they're cleaning all the areas of their hands, top, bottom, in between the fingers, grasping around the thumbs, even cleaning around the wrists and getting the fingernails, because these are all areas that people tend to miss when they wash their hands. Soap and water is excellent. If you don't have access to soap or water, then an alcohol-based hand rub or sanitizer is also okay, as long as you're getting all of those areas of the hands. Hand washing should be really frequent. Absolutely, upon coming into the house should be the first thing that you do so that you're not contaminating the environment in your home or transmitting what might be on your hands to your family members. But also before eating, before touching your eyes, your nose, or your mouth, all those mucous membranes that viral particles can get in. So we also are learning more and more about this virus that has the ability to live for several hours on clothing and potentially even several days on metal surfaces. So those are things to be aware of and to think about when looking in your home, and also consider if you are ill or if you think you've been exposed, changing your clothing upon coming home, and really making sure to focus on porous things that might be more difficult to clean and metal surfaces.
And now I'm sure our community members are wondering, how has Sturdy been preparing for COVID-19 here in the Attleboro area?
So our primary focus for Sturdy is to both keep our patients protected as much as possible and with as many resources as necessary to care for them, but also protect our healthcare employees as much as possible. And in that vein, we have restricted visitors completely from coming to the hospital. The only scenarios in which visitors are permitted at this time is to have a laboring partner or a screened doula for mothers who are in labor, or for patients who are at the end of their life or critically ill. We are making case-by-case exceptions to allow a restricted number of visitors who have been screened for any symptoms from entering the hospital. We're trying to prevent illness from coming into the hospital except through the patients. And of course, taking as many precautions as we can to separate and use the appropriate personal protective equipment for our healthcare workers when they are evaluating patients with suspected COVID-19. In that vein, we're also having a lot of difficulty with personal protective equipment supply. This is because a lot of the world is depending on this supply at the same time, and much of it happened to have been made in China, where a lot of factories were closed down because of COVID-19, which has been around since the end of December. So what we are trying to do at Sturdy is to make sure that we are using masks appropriately and that we are reusing them safely so that healthcare workers don't contaminate or infect themselves when either donning, putting on, or doffing, taking off masks. And we are also using gowns and gloves to protect their hands and their skin, their clothing, from getting respiratory droplets on them, and shields to prevent respiratory droplets from getting into their eyes. We are doing whatever we can with the personal protective equipment supplies that we have. We're hopeful that with this declaration of the state of emergency for Massachusetts, that we will have access to state stockpiles of emergency PPE, and that we may have a little bit of repletion of our supplies. But in the time being, we're being very careful about using them and safely reusing them.
Is there a task force?
Absolutely. So we have a task force that is made up of senior management in the hospital and has representation from all of the key departments in the hospital. And we meet regularly, oftentimes daily, to discuss what we are doing in preparation for and in response to COVID-19. But as we are all learning, this is a situation that's evolving constantly. So there may be recommendations or guidelines that change on a daily basis. So we're all trying to communicate electronically, communicate by phone, do as much as we can remotely, because we're also trying to limit our face-to-face contact and having too many people in one room at one time. So congregate settings, we're not having any meetings of people more than 25 at a time. And we're doing as much, as I said, as possible remotely. But we are addressing how these guidelines are changing really frequently, and making sure that as new issues and thoughts come up related to this, whether it's in patients with chronic kidney disease who need dialysis and have to go to dialysis centers, or women who are pregnant and need prenatal care, or employees that might be at risk or have been either exposed to a potential patient or are becoming ill themselves, that we work through occupational health and we all are addressing these issues and making plans and putting policies into place as soon as they come up.
Well, I thank you for your time today. Is there anything else that you would like to address before we wrap up?
I think just as a kind of final statement about this is probably not anything that any of us thought in our lifetimes that we would be facing. And so it is very scary to be dealing with this. And we're not quite sure what direction it will go in. We're hoping that all of the steps that we're taking right now with social distancing, with really strong emphasis on hand hygiene and trying to reduce the possibility of transmitting infection to others in our homes and our community, and the restrictions that we're taking on the side of healthcare to try to protect our patients and our healthcare workers and keep in mind our limited resources. We're hoping that all of these steps, they're not meant to be just frightening people, but are really a preemptive plan in order to prevent what could potentially be a healthcare disaster as has been experienced in some other countries before us. We're trying to learn the lessons that China and that Italy are learning right now and Iran is learning right now. And we're trying to learn from them before the same thing happens in the United States. I'm sure a lot of people have heard about the idea of flattening the curve. If you look that up, you can even Google that term on the internet. Basically, when hospitals are taking care of kind of a usual number of patients, they use their resources in a really kind of predictable way. During flu season, we always anticipate an increase in number of people that will come to the hospital with respiratory illnesses, because with it, influenza can also bring an increased number of pneumonia, and people with chronic lung disease tend to come to the hospital more during flu season. But what's really different about this is that this virus is spreading very quickly, and it's spreading in a way that makes it difficult for us to get a handle on, because a lot of people think that they might have the flu or might not even be that sick, maybe just a minor cold, and think that, well, this probably isn't anything. I work through this or I go to school with this all the time. And so they're continuing their usual kind of social interactions and perpetuating the spread. And like we said, in about 80% of people, that may be no big deal. You have a minor illness that you can suffer with at home, but it's the compromised patients, the people who are older, over age 60, the people with those chronic medical conditions that we talked about, that they will be coming to the hospital in large numbers. About 20% of people who are infected, like we said, will get severe or critically ill, and they will need those limited resources that we have in hospitals. So that really makes a high peak of patients coming in to access healthcare. And our hospitals, our healthcare system in the United States is really not built to be able to handle a large influx of patients at one time. So what we're trying to do, rather than having that peak of patients coming to the hospital and all demanding care at the same time, is to flatten it out so that as we slow the spread, hospitals have a better chance of being able to handle the increased volume of patients coming to need critical care or need hospitalized medicine, so that we can give them the care that they need and really not put ourselves in the position, like some other countries are having to do, of rationing care, rationing ventilators, because they just do not have the ability to take care of all of the patients who come seeking care. So the flattening the curve is very important here. So all Americans, all people here, we have to feel like we're in this together and take it seriously. Stay home. If you need to go to the grocery store, send one person from your family to go. Clean off the shopping cart with bleach wipes as you walk around. Stay 6 feet away from everybody who's in the store with you, who's hanging out and having a coffee. Everything should be to go. Wipe down your cup even when you get it. Like, we're really trying to take all of these precautions so that we stop spread now before it becomes a critical problem later.
Well, thank you for your time. Where should people be getting the most updated information regarding COVID-19?
So the CDC, cdc.gov, has actually been a really good website in terms of providing information, and they break it down by information geared towards healthcare providers and information geared towards the public. There's even further breakdown for what schools need to know, what people need to know who are already on quarantine or isolating at home, ways that they can clean their environment and decrease the risk of spreading to other family members. There's a lot of good information on there. It does change frequently, and they do a good job of putting updates for when they've updated information.
Okay. Well, I'm sure as this evolves, as it's rapidly evolving, we'll be talking with you soon.
My pleasure.
Thank you.